Perfect. All right, fantastic. Well, let's go around the table and introduce ourselves. Aidan, can you start, please?
There we go. Hi, I'm Aidan Murphy. I am the head of operations at Barrow Forward Limited, operating one of the leisure facilities for Westmoreland and Furness Council up in the north.
Thanks, Aidan. Roland?
Hi, I'm Roland. I'm the Managing Director for Lambton Leisure, managing the Hounslow Council leisure facilities.
Thank you. Darren?
Morning, Darren Simpkin, MD for Knowsley's Leisure Services under the brand name of Volair.
Rhys?
Yeah, morning, Rhys Jones, Chief Operating Officer for Plymouth Active Leisure, running the facilities down in Plymouth.
Thank you. Andy?
Hi, Andy Carolan, Managing Director of Active for Today, Nottinghamshire.
Brilliant. And John?
John Oxley, Chief Exec, Stockport Active CIC, otherwise known as Life Leisure.
Thanks, John. And John, you did say you might have to disappear depending on timing today.
Yeah, apologies. Yeah, I've got trying to multitask.
Okay, no worries. Julie. Yeah, I know that feeling. Julie, do you want to say hello?
Yeah, I'm Julie Davis. I'm the founder of Doing Our Bit. At the time of working for Doing Our Bit, at the beginning, I was a Deputy Chief Operating Officer for a clinical research network in the West Midlands for the NHS.
Brilliant. Thanks, Julie. And Anthony?
We have a platform that aggregates data for live bookings, and we were asked to join Doing Our Bit about 4 years ago, so we've been supporting the campaign since then.
Excellent. And just for pure clarity, I also voluntarily help out with Doing Our Bit, doing all kinds of different things whenever I can give it the space and time that it deserves. But Julie, we need from you, what is Doing Our Bit? Why did you do it? And what's the impact that you're having?
So if we go back in time to pre-COVID times, in the NHS, wellbeing was quite a new word. I think we were quite far behind the sort of national curve in terms of health and wellbeing. So as Deputy Chief Operating Officer, I implemented a wellbeing programme. What we wanted to do was try and support the staff a little bit more, try and make them happier, healthier, both for mental health and reducing sedentary behaviour really in the workplace. So we adopted sort of a pick and mix approach to what we wanted to deliver for our staff. We had 180 staff in our network, but we were part of an NHS trust that has 10,000. So we had workshops, we looked at menopause, all these types of areas that are sort of quite niche now. But the main part that we wanted to try and introduce was to reduce sedentary behaviour. So we started circuit classes. Within a year of our wellbeing programme, we reduced our sickness absence by 40%, which is a huge amount in one organisation. As probably expected, that was generally musculoskeletal and mental health related absence reduction. I don't think absence reduction is the only way of measuring, obviously, but again, in the NHS at that time, it was literally the only way of measuring whether something was having an impact. So what we wanted to do was widen it out more to our staff, both within the network and the NHS. And then COVID hit. So in January 2020, we needed to think of a different way of doing everything we'd done. We'd made such an impact, we'd made such an improvement. We knew times were going to be hard coming up. So what could we do then to ensure that our staff could maintain what had happened before? So obviously everything in person stopped. We were all still within the hospital setting. The majority of our staff were, but everything stopped. It was absolute chaos everywhere. Everyone was starting to get burnt out or tired. You know, there were no things like days off and weekends. It was just one long slog, really. Gyms were closed, obviously. So what we did initially as employers was we went online, same as everyone else, we went online. My husband is a personal trainer. So what he would do is do sessions a couple of times a week for us. The usual sort of live Zoom sessions. And then trying to keep the staff active. And what we wanted to do with those was keep the group mentality side behind it. So people would join a Zoom session or a Teams meeting, have a little bit of a chat before, and then do the session and a little bit of a chat afterwards. Those went on for around 3 months, I think. And actually, by that time, I think we started to realise that lockdown was going to go on for a lot longer than we thought. So we needed a bit of a plan B, because somebody who's got a day job, so my husband is a personal trainer in his sort of second job, someone's got a day job, it's not really sustainable to keep that going on a, you know, a couple of times a week on a regular basis. So I decided that I would get trained up to be a personal trainer, and I could deliver those sessions. Conversation with the training provider, trying to work out how this could sort of work for us. And the idea was that if I could do that and we could support our staff, then actually maybe if it was online, I could support the wider 10,000 staff as well at Wolverhampton. During those conversations, those early conversations, realised that actually there was probably quite a bit more to this, and have an opportunity. So rather just have one person doing a Teams meeting, actually could we have a collection of videos that would be available for staff to have on demand? So create a little mini portal for us. And then, as they sort of say, to cut a long story short, we got a few other people involved. So we set up a working group with Active IQ, FibreDo, and Study Active, and Action PR, and really started to think, right, what could this look like? You know, are we on the edge of something potentially quite big here? And I think that's absolutely what did happen. We worked out who needed to be involved if we were going to scale this up and have doing our bit. And the whole concept behind doing our bit is that it's a free fitness platform. And the name comes from the fact that everybody involved in it all the way through has offered their sessions or done their bit free of charge. And it was a time of when everyone was clapping the NHS staff, and you know, everyone was willing to be a volunteer for everything. I think we picked a really good time to sort of try out this concept. So we sat down as a working group, worked out exactly what it was that we wanted, what it could look like, and then who needed to be involved. So there was a huge call of action from all the partners to reach out to fitness professionals and say, will you give us a video and offer your time and do your bit for the NHS, and we can have it on the platform. Royal Wolverhampton Hospital, who was my overall employee at the time, was like, yeah, we want in on this. So our 10,000 staff definitely want that. And within 6 weeks, we had the platform up and running, which is amazing to have a collection. I think it was 60 videos to start with. So we had 60 personal trainers doing videos. We had all different levels. We've got people in gardens working out with their children, but people really stepping up and going, right, okay, I want to be part of doing our bit. Within 24 hours of it going live at one trust, we had 200 people sign up, and that trust has 10,000 staff. So the need was there. And then quite quickly, again, as a working group, we were like, right, this could be bigger. So that reduction in the absence that we had as one organisation, one part of an organisation, actually scale that up across the NHS, even if it was much smaller. And it's like, we need to offer this out wider. So we scaled it up. The aim initially was to have access for all, equity of access. So no matter what job you did in the NHS, whether you were the chief executive or a porter or a consultant or a nurse, you would have access to it. That was quite tricky initially because of email addresses and things like that. It's how do you reach the people that may not be on email every day, so your porters and your healthcare assistants. So there's some work to do there. The aim was always to support the NHS throughout the pandemic and to try and get them healthier and give them something that they really felt would benefit them and their staff. We always wanted to offer the best quality, so every video that we put on the platform was quality assured and ideal for all fitness levels as well. So right from seated workouts to people that are, you know, we've got marathon runners doing our yoga sessions and things like that. So really did sort of mix for all. And then we started to make sure there was some mental health, not workouts, mental health videos and things on there as well. So we were trying to reach out to everybody. Excuse me. So over the sort of next year or so, we really built up the platform. We were the finalists or winners in around 7 awards during the first year. I think people really did see that this could be something that would work really well. And by the end of probably 18 months to 2 years, we had 130 NHS organisations signed up to doing our bit with a reach of 750,000 staff. But for us, it wasn't so much about the reach, because a reach is just potential. It was like, how can we improve this? How can we post-COVID it? You know, it was all about a legacy. This was a legacy that was going to last long beyond COVID. And how can we improve the content? So the first sort of revamp that we started to look at was, you know, we're in post-pandemic now. The videos that we had on there with people doing, you know, boxing workouts next to the washing machines was great at the time, but we really felt that we could improve the content and upgrade it. And it was during we had a stand at the Independent Gyms Conference, and we met Johnson Digital, and they loved the concept of it, and they offered 400 videos. So those are professionally produced. They have our logo on, so they are doing our bit branded, and again, we can just keep seeing where this could potentially go. So feedback wise at this point as well, we were working with our NHS wellbeing leads and the end users to say, right, okay, we're thinking of improving it in this way. What do you want to see? By this point, again, we'd opened in not only just in NHS organisations in England, but NHS and social care organisations in Wales, Northern Ireland and Scotland. It's huge in Belfast. They absolutely love it in Belfast. We've been on the news and everything there. So it's quite nice then to get that feedback from the trade unions, from the wellbeing teams, from the staff all across Great Britain to see what of an impact it's making. And we were finding from some of the wellbeing leads as well, which the real aim that we wanted, we were finding out that we were getting the active, keeping the active, but actually we were getting the inactive active. So we were hearing a lot that people were doing their first workout since school. There's a lot of people that probably don't have the confidence to go into a gym, and they suddenly had this free platform there with endless videos for them to start getting active. And then we could start moving towards sort of a bit more of bespoke sessions for people. So we had, we wanted to make it very reactive, and we had an NHS employee contact us, and this really does sort of remind us sometimes why we did what we did. And she was stage 4 breast cancer. And all she said was, I want a better body before I die. Which sessions do you want me to do? So, and it still sort of gets to me now when you do get that feedback. So we contacted a cancer specialist, and she did workouts, bespoke workouts for her. She contacted her individually as well and kept in touch and helped her through her journey. But it really was the whole, this is why we're doing it. Now we got to that stage, and then we were like, right, we've got the reach, but the reach isn't enough. We've got the content, but actually can the content improve even further? So the next steps then were to improve the offer and reach out to people to be able to do in-person classes like this lady had been able to access, and to change the sign-up process. So rather than have a reach where it might go to an organisation, the organisation signs up as a whole, and then very much it revolves around how active that wellbeing lead is. Are they going to constantly reach out to their staff? We still find that staff going, I've never heard of it. So we know that we needed to adopt a different approach. So it was around the offer and the sign-up process. And I think we currently have around 30,000 active users rather than a reach. And that's what we want to concentrate on, to not just have this offer, but to have it really embedded from the bottom up, top down in the NHS, and equity of access for every single NHS and social care user. And that's where we are at the moment. So if I hand over to Anthony to talk you through the next steps and how we want to improve it even further.
Thanks, Julie. Are there any questions for Julie before I start? Okay.
No, well, just an observation. I mean, it sounds absolutely fantastic. You've gone through it from the embryonic stage and the kind of COVID initialization, I guess, of it, Julie, and to where it is now, and you recognise the need to make it more that legacy and make it live, and how you improve it going forward in terms of reach and particularly the content, and keep it fresh, I guess.
Yeah, absolutely.
So from our point of view, taking on where Julie brought us to give you a bit of background, we started to upgrade the platform and the app and create an app about 12 months ago to bring online not only the to improve the video libraries, but to do live stream sessions and also in-person activities. That is now built, but it's taken quite a while to get it where it is, and the security issues, as Julie was alluding to, with regards to email addresses, but whether people use personal ones or NHS ones, etc., etc. But the bottom line is we released a couple of comms at the beginning of March, and we have 140 trusts signed up today, which is about half. I think there's 276 trusts in the UK. 40 trusts have confirmed that they will engage their staff. There's two ways they can engage, either through an invite, which comes from our system. They upload their database and it's sent out from the system. That for us is the best one because we now have all the user data, or they post materials. It's about 50-50, the feedback at the moment, which one they will use, but those are due to go out over the next, before the end of this month. So by the end of this month, we will know whether we've got 276,000 people uploaded to our systems, or whether they put posters to drive 276,000 people. That was one email, and as we were saying, 40 trusts out of the 140 have confirmed, and we get regular emails, asking how they can get more involved and one thing or another. So I would imagine that before the end of the summer, we would expect the majority of the 140 trusts to be on board, if not, a good way into the 276 of the whole trust across the UK. The app has been in the App Store since early May. It's not been advertised. You can't see it. It's a private app because obviously it's restricted for NHS and social care users. We've had 1,000 downloads with no communications. And since that app has been in the app stores, the data back is 13% of engagement to the platform has been through web, 54% iOS, 33% Android, 87% through app. So again, going back to Julie's idea about lead about how do we make this more accessible, more often, better content. So it seems that the app in its initial things, even without publicizing, has been quite successful so far. I've got some notes here, sorry, let me just, initial feedback with the trusts, they highlighted a couple of areas that we've further developed the app, and that is that they can invite friends. Sounds easy, but again, it's a little bit complicated because you have to verify that people work at the trust and so on and so forth, and also create groups. One of the biggest barriers that we see with in-person activities, whether they're live streamed or in person, is that people would rather do it with somebody, whether that's a work colleague, a friend, or a family member. So we've allowed the system now to create groups as well. The apps have been updated next week to include that, so that'll all be live this month. The comms over the next 3 weeks are to tell the users, the 30,000 users, the legacy users, that the app and video, the app is now available and they can screen their videos through it. They can live stream activities shortly, and that's through our first supplier for that is UK Health Coaching Association, which is more about sleep issues and things like that, rather than physical fitness. And then in-person activities coming on later. So the consumer now is aware that there's the product is developing with regard to what's available through it. We have done some preliminary data captures, and I spoke yesterday to a number of our clients, which we have some blue chip clients like Diageo, Shell, and the feedback is that they will start to use the same data captures. So just for your information, that this is quite a unique opportunity that the NHS, doing our bit, could actually lead in some way in starting to define some of the data captures coming out of this system and its use, credibility across the corporate sector as well. We obviously have user capture with their friends as well. We have device capture, how far in advance people are booking, the gender of the people booking, whether they're booking for themselves, on behalf of other people, the days in ahead of bookings, the time of days when they participate, popular activities, how far people travel, all that type of stuff. At the beginning, we are, it's easy to do videos, and we have some great partners, as Julia mentioned. We have Johnson Digital, we also have Fun and Moving. We have the independents, we have health UK health coaching, and we also have potentially Les Mills, I think, which we'll probably confirm in a couple of weeks' time. So we get data on all those things, which is great because it's all accessible to them today. The live streaming stuff is accessible today because it's not location based, and we're starting to tell the user now that we will populate over the summer months, and by September we will come up with a figure of probably 10,000 activities a day or something like this. And that's obviously where you guys come in, because we've got pockets of now appearing across the UK. We've got over 100,000 potential users in Bristol and Cardiff. We've got the Manchester NHS Trust, which is 27,500. We've got pockets of NHS trusts that popping up, and like I say, and like we've said, our comms are only just really beginning, so we believe that will escalate quite quickly, and the key really is to be able to offer them things in their communities as opposed to to take them on a well-being journey, whether that's watching videos, doing a live streaming session, or in person with friends, with colleagues. That data is all to come. So I think that's the exciting part for us. Yeah, I don't know whether it's enough from me, David.
Yeah, Anthony, just hold, and we'll hold questions just for a second, because I just want to explain why I wanted to be involved in this and why I think we should be involved in all of this. So from my perspective, I thought this was a really strong opportunity for us to be able to demonstrate what we can deliver to a very big workforce, that also we need to understand their language and they need to understand our language. So I thought, what better way than actually getting people to take part in activity, etc. So what we're going to be looking for is operators to sign up to doing our bit and offer classes to NHS team members and social care team members at no initial cost. We can limit that. It can be one a week, it can be one a month, it can be whatever it is, but it's a brilliant opportunity for you to be able to introduce the brilliant services and the team members that you've got to those people who are working in those NHS trusts and social care. So we get that chance to give confidence, to share language, to enhance the health and well-being of those communities that work within those organisations. It's a massive workforce. So actually, it's probably a massive opportunity for us as well, because if we get those experiences right, there's no reason why they can't interact with us as a customer, as a member, whatever it happens to be. I'm sure some of you've got 999 memberships, for example. A great way of enhancing those 999 memberships that you currently have. But ultimately, this is really about building partnerships. And, all of us that listen to John and the leadership side of stuff, it's all about relationships. It's all about partnerships. It's all about those connections that we make in order to be able to deliver it. And sorry, John, I'm going to use you again, but you use a really interesting word, which is selflessness. There's a real opportunity here for us to be able to give in the first instance in order to receive at a later date. But I also wanted to remind you that actually this is well-being, this is nutrition, this is finance support, this is physical activity. This app that gives people access to holistic well-being services is so important. UK Active are behind us, Simspir are behind us, they're happy to do that. And we're also working on getting a large business to consumer sponsor in order for us to really populate this voluntary team with people who are paid to deliver action around getting more trusts on board, getting more operators on board. What we're looking for as part of the conversation is there a pathfinder out there? Is there somebody like Roland who's pathfound on the agency model, somebody who's prepared to say, yeah, I'm going to sign up for this. We want to be part of this. We want to offer this to the NHS Trust in our area. We want to see what we can do. And with the data that Anthony can give us as part of the app platform, we can start really understanding that piece around, are we just attracting those active NHS people, or are we attracting those inactive people who want to give something a go, who want to try something, who want to improve their health? And that type of data and insight will be really powerful for all of us when we're talking to our partners and to our clients around the impact that we're having in a location, which of course, as we all know, is where all the funding's currently heading and where all the effort is going into those different locations. So that's why I wanted to bring this here, and it's also why I've been part of the stakeholder group, volunteering time in order to make this work, because I think this is a really big opportunity to really build a relationship and partnership with organisations that we keep saying we need that relationship and partnership with. This is just another entry into those conversations. So, any questions? Anything anybody'd like to know?
Yeah, I just want to say thanks to Tony and Julie especially for bringing this to us, and I can tell how passionate you are about this product and the impact it's having on people. When you were talking, I was thinking to myself, oh my gosh, this is what my team and I are trying to figure out right now. So one of the key things that we want to deliver is not just people who come into the centres. We want to try and reach people who can't afford to come into the centres, even with the concession prices that we have, that is still unaffordable for certain people. So we're looking at how we can go into the community and so people have access to exercise from their living rooms, and that is an area that we're looking at. We're working with a company called Move GB or something like that, who are giving us online type product, but that of course does at a cost. The question I have is, I hear you say it's just NHS workers right now. Is that correct? Or healthcare?
Yeah,
If I
NHS
jump
and
in,
social care.
yeah. So if I confirm that as well, because it's been nuts really what's been going on. But NHS Trust, 1.4 million staff. Social care organisations, which we can't really get a list of yet, we're still trying to find it, is 1.6 million staff, but we've got 48,000 coming on in the Cardiff area for social care. We've got NHS confederations trying to sign up, and we've got GP federations trying to sign up.
Okay.
So it's already expanding.
Yeah. So we are currently also working on a discounted membership package for frontline staff. So it's NHS, it's 999, it's fire service, police, and the military. It's something that we're looking at now, and I think this would definitely enhance what we offer to NHS employees, and I would definitely be interested in having a follow-on conversation with yourselves and my health and well-being team to see what we can do, how we can work together.
Roland, just one thing to say, and just hopefully this is of benefit to the group. The language on the website has been carefully curated to say free at time of participation, and what that's meant to say is we would like to have funding for this longer term because it's sustainable with funding. But that's a separate conversation for another day. But as David said, even if it's off-peak times, 1 or 2 sessions a week, and grow from there, whatever's comfortable. But ultimately, there are large audiences, and it makes no sense that if everything is free. So
of course.
Brilliant. Thanks, Roland. What I'll do is when I circulate the recording to everybody, I'll also circulate email addresses for Julie and Anthony so that you can get in contact if you need to. Reese.
Yeah, cheers. Yeah, thanks, Julie and Anthony. Are you in Plymouth at all at the moment? Is there people registered in Plymouth? Do you know?
It's a funny one. You should mention Plymouth. I don't believe the trust is registered, but I believe Plymouth is the place. It might be Portsmouth, Plymouth. I think Plymouth is the place where people are registering independently. We don't know how they've.
So I'm really keen to pick up a conversation because we're about to launch something called the Active Health Programme in Plymouth. So we're very closely aligned to public health. Chair of my board is the Director of Public Health. So basically that programme is 12 weeks for free, and it's designed to attract people from who've never thought about being physically active before. So it's really those kind of hard to reach areas, but obviously that's extended to the NHS as well. So there's definitely an opportunity in Plymouth where I could kind of move you into that existing programme, what it might be. So there's various models within that. So whether it's identifying certain classes or sessions, obviously it is tailored to people who've never been to us before. That's really the idea of it, rather than people sort of getting a freebie or downgrading a membership or anything like that. But dead keen to have a chat with you about how we do that, because I think we've got some really good links across our system already, and it could kind of just bit hand in hand with what we're trying to achieve.
Good. We'll share that with you, Reese. I think there'll be some opportunity there to be able to connect the two together. So, anything else for Anthony and Julie? John, oh, Aidan. Aidan, you're on mute. Sorry, mate.
Sorry. Firstly, I think it's a brilliant idea, and there's a real taking a really bad time in our lives and used it for good. So firstly, well done. I think it's a great idea. Yeah, so I'm on the website now. I've downloaded the app, so I just, it was on the App Store and I can download. I can't, obviously, without an NHS email address, I'm assuming, register. And I'm on it now, where they're doing our bit for leisure centres, and it says that the bookings would be done through the app. So that I really like the idea of giving away, you know, a class a week or 2 classes a week in off-peak times to give back. You know, yeah, I think David's right. We'll reap the rewards in the long run. And it's not, we're more than just the private organisations that are here to generate an income. So I really like the idea. I suppose the question I have is, I can block off a studio here and pay for an instructor. But would I be able to load as my account of doing our bit? Would I be able to load that class from my area and people be able to book on that area, or I would be afraid that I might be inundated with too many people coming through the door if it was just a walk-in service?
No, I'm sorry. For some reason, I just got kicked out there for a second, but I'm here again now. The way the system works is you create a profile on the system, and we'll explain about APIs and connecting with the incumbent software providers in a second. But you create a profile. It literally takes minutes. We have already curated sort of 10 template products, which we call about. One might be boxercise or yoga. If you want to add other things, let us know. So these are the categories. And effectively, you just apply a schedule to it. So you could put Thursday at 3 o'clock, 2 spaces, Monday at 10 o'clock, 4 spaces. And that's what will happen. And then you'll get notifications if one of your staff members downloads an admin app that we have, which is called FibreDo for Business. Then they'll get notifications pushed through on the apps when NHS staff book. There's a little bit of work. You'll have to, obviously, if you're using an internal another software provider, you'll then have to put them into your diary and say that, you know, Julie's coming on Tuesday at 10 o'clock. And that literally is it. The system will give you reports on the data we discussed before. It'll compare it to what's happening in other regions and things like that. But that's how the system works. It's a very, very simple sign-up process, and it's a very, very simple, more importantly, sign-up process for yourself, a very simple user journey. And then there's just a little bit of work about how you transfer that name into your current system. We are talking initially, the conversation is more advanced with the Explore. So we will write an API where we can then just share the data straight out of the timesheets that operators that use that system have direct into the system. But at the moment, everyone's busy, and that's probably a few months away. But at the moment, it's very simple. It's free to access. Like I say, you create a profile, post whatever sessions you want, and hopefully the staff will start accessing.
And that's the point, Aidan. Sorry, Aidan, just to reinforce, it's you don't have to put on extra classes. You can make space available where you've got space, and you can limit the number of spaces that you offer as well. So this isn't about creating new activity. This isn't about paying more instructors to come in. This is about it, to be selfish. This is about you as an operator recognizing where you've got capacity and trying to offer that capacity out to individuals. Now, of course, you could always book 2 spaces in every single class for this product, so that you really are giving back and you really are doing your bit. But those are the choices you as an operator have.
Brilliant. Yeah, and there was just the other one was just a bit of an observation. As Roland already mentioned, he's in a conversation about online streaming for fitness, and we all kind of pay various platforms to roll out that online fitness as a product to our customers. And you mentioned sustainability, Anthony. I wonder if selling this as a product for online to operators like ourselves would we could roll it out to our customers, and we could pay probably, I imagine, a cheaper rate than we pay other providers for this, because you already have the content. I know it's a bit of a people are giving this content for free, and we would be paying you, and you would be making it funny, but that would make it sustainable in the future. So that's just an observation from me, because I'm looking at, like Roland, I'm looking at potentially giving some online exercise available to my customers as an additional benefit of joining us, type thing. So I think that would be a good move potentially.
Yeah,
sorry, just to follow up on what Aidan has said. So we've been paying to provide online and virtual classes to our customers since 2021. We've been paying less meals and move UK or move GB. And as Aidan said, I'd rather spend my money supporting the work that you guys do than these other operators.
I think that probably not a conversation for today, but we do have good relationships with the content suppliers, and you know, the more access they get to people, the better for them. And but we're definitely open to the conversation. But I don't want to tread on people's toes at the moment.
I think Roland, Aidan, we need to look at the governance from a point of view of the stakeholder group around how that can work for us and for those people who have done their bit by providing access. But ultimately, it's an interesting question, because, of course, if we can self-sustain through that, that actually makes a real difference to everybody. So that does make a lot of sense. But I think we need to have a look at the governance and go through the stakeholder group there. So thank you for that.
There's one thing to just say there about the live streaming stuff. It's not there yet. But we are doing live streaming through UK Health Coaching, which is a different sort of service group, probably bought, which is fine. But a number of the trusts have inquired about converting a room into a live streaming studio, for want of a better word. So there could be a schedule of classes that are live streamed into NHS trusts, which is, people that then can take a break at work, look at the scheduling, but that's something for next steps. But I think that idea that there's always live streaming sessions from around the country is really quite powerful. And the trust there, all they're doing is making a room available with shower facilities, and people can take a break and do a session.
John, I'm just going to ask quickly, because I think you were part of the group that heard this from GM Active. Was there any feedback from the GM Active group that we might want to consider here, or do you know if there's been any progress? Because I have chased John, but I haven't heard anything back.
Yeah, Dave, I'm sorry, I don't know.
Okay, that's fine.
But I think that there are increasing conversations going on with NHS partners. So I think the conversation, the dialogue is stronger, so connections are better, but I couldn't update you on where everybody else is.
That's fine. Okay.
And just to say, if anybody would like to access NHSs in their areas, or can tell us which ones are local, then please tell us, because the chairman of UK Active, I'm sure you know, is a guy called Mike Farrar, who has basically said, if anybody trust-wise doesn't sort of get on board, please let me know, and he'll rattle away. So if we know if it's Plymouth, then let us know. And if we haven't got a good, open relationship signed up with the NHS, then we could certainly find out who it is and move that relationship on.
Okay. Julie, anything you'd like to add? Oh, Julie might have frozen. Oh, no, that's fine.
I'm gonna move it. I think my camera's frozen. Can you still hear me?
We can. Yeah.
There you go. No, I'm just appreciative of all your time and some good ideas there as well. Love the fact that if we could become a bit more self-sustainable, that might be a way of looking at things in the future. But nothing else to add from me, but thank you all.
Okay. Anthony, anything to throw in?
No. If anybody's got any questions, let me know. We can give people access to the system.
Okay. Any other questions? Any other queries? No. Well, in that case, Aidan, good timing. Go on.
It just I have no idea if my trust, like Risa said, so the Morecambe Bay trust is where we're based. I don't know if they're on board or not. Is there any way of identifying who is and who isn't on board in our areas, so we could even help with that process?
Yeah, I think the easiest way to start is just let me know it's Morecambe. Send me an email, and I'll check our databases, and if it's not, either through Julie or through our networks, we'll find out. I spoke to UK Active yesterday. I mentioned it to Julie, and David's aware, but not aware that I spoke to them yesterday. We've asked UK Active and Mike Farrar whether they would have any recommendations for a couple of board members for doing our bit from the NHS. So I think once that happens, then it'll be an awful lot easier for us to say, let's get Morecambe on, because we'll have somebody within, hopefully. But yeah, if you let us know, we can certainly reach out. We've got all the contacts. Julie's, all the contacts are on the system, and we can get in touch with them.
Brilliant.
Okay, Darren.
And you're going to provide the contact details for Julie and Anthony, aren't you, Dave? Yeah, great.
Yeah, absolutely. Yeah, I'll send it out to everybody with the recording. So, okay, excellent. Well, in that case, Julie and Anthony, thank you so much for your time. I'll share your contact details as stated. If you two wish to leave, you can leave. We're just going to have a conversation just to make sure we're all up to speed with what we need to be, and we'll catch up soon. Take care, Julie. Thanks, Anthony.
Thanks.
Wonderful.
Bye.
Thanks again.
Cheers.
Thanks.
Cheers.
Cheers, guys.
Okay, I hope that was useful. I think there is an opportunity. We need some pathfinders. I need people we can tell a story about, because that, as we all know in this sector, everybody likes a pathfinder. Everybody likes to follow rather than to lead, unfortunately. So if anybody really is up for this, very quickly, let's just get in contact with Julie, Anthony, or myself, and we will progress this forward. I think this is a multi-lensed opportunity to really have conversations with people we keep saying we want conversations with. So let's do something practical about it. All right.
Yeah, no, I think it's quite supportive. It's a good idea.
Thanks, Darren. Okay, excellent. Anything anybody else wants to grab hold of before we leave? You all know we've got the AI session on Thursday. Yeah, that's fine. I'll send an invite for the next Friday meeting that we've got. And it's really nice when I start hearing about people making contact outside of these groups and just sharing and talking. It's the power of the group. So thank you all for contributing to that and to responding.
It's Wednesday, isn't it, Dave? It's not Thursday.
Yeah, it's Wednesday. That's right.
Sorry.
Yeah. And then the Friday, whatever it is in June. So, but I'll get that out later. All right, and I'll send a reminder about the Wednesday one as well, just in case. All right, fab. Right. Well, if there's nothing else, leave you all to enjoy the sunshine. Have an active weekend, guys, and we'll see you all soon. All right. Cheers. Thank you.
Thanks, guys.
Bye.
Cheers. Bye. Bye.
Cheers all.
Bye.